And topping our news tonight, a grim milestone as Kern County surpasses 400 lives now lost to the coronavirus. It's another reminder of how this virus has its grip on our county as it steals the lives of hundreds of our loved ones. However, there are hundreds of additional deaths here in Kern County that remain a mystery to health officials. 17's Alex Fisher has been working on this story since the beginning of the pandemic, and he's been tracking the trends and joins us now with the story you will only see on 17 News. Alex, good evening.
Hi, Jim. Over the past few months, we've heard misinformation and bogus claims about coronavirus and how it's impacting our lives. Some falsely claim it's less deadly than the flu, or every death is ruled a COVID death, making the numbers appear to be higher. I wanted to see if there was any truth to those claims, so I requested the total number of deaths in our county. Those numbers include deaths of every kind, including suicides, homicides, people who have died from other diseases or natural causes. I've collected the data, and it is indisputable. COVID-19 is deadly and ending lives. And we saw that this summer when hundreds were taken from us. But I also found hundreds of additional deaths not attributed to COVID-19. 2020 is different because more people are dying. Blame coronavirus.
It is above what we would expect to find normally.
We've lost more than 400 lives attributed to the disease. Without knowing we're in the middle of a pandemic, there's evidence something is causing more people to die. And it happened within a matter of months.
Probably the biggest thing that stands out is how severely we can be affected and how quickly.
Our local health department keeps track of all deaths in the county. We've requested the total number for the past 5 years and looked for trends. There are ebbs and flows depending on the season. Year after year, more people die in the winter than summer. Local health officials say it's because of the flu and other respiratory illnesses. This year started out like any other, but as soon as coronavirus hit, more people were dying.
If you look at prior to COVID-19 being introduced into our community, people weren't dying of COVID-19.
The increase in deaths became noticeable in May, but the overwhelming spike came in June, July, and August. Prior to this year, our deadliest July over the past 5 years was in 2018, when 505 people died. This year, 735 people died in July. 123 of those were coronavirus deaths.
There is a very real risk of severe illness and death that we can clearly see in the numbers and the number of people who have died due to COVID. Because if COVID-19 weren't here, the basic assumption is all of those people would still be alive.
But there's an alarming number of excess deaths, and coronavirus is not considered a contributing factor. Our statistics show there are 861 more deaths now than where we were at this point last year. 406 are attributed to coronavirus. That leaves 455 additional lives lost this year compared to this time last year. Our health officials say they're still trying to understand why.
We know the COVID-19 pandemic has affected all of us in many different ways, and that, can reflect in our health. It is a little bit more difficult to explain some of the other deaths because their cause of death is not COVID.
Although a vast majority of people survive and recover from coronavirus, lives have been lost. Even more are at risk. The age group hit hardest is people over the age of 65. That's about 90,000 residents in Kern County. We've already lost 247 of them. Most people who die from coronavirus have underlying conditions, but coronavirus is still responsible.
The question is, does it go on the cause of death? If this person had not had a COVID-19 infection, would they still be alive? And so that's sort of the general question that normally happens, when healthcare providers are determining a cause of death.
Here in Kern, diabetes, hypertension, and cardiovascular disease are the top, followed by obesity, lung and kidney disease. Even asthma is on the list. Here's the concern. Those underlying conditions plague our community, putting many at risk of severe complications or death. More than 80,000 people in Kern County have diabetes, according to our local health department. More than 300,000 people are considered obese.
So we know those conditions exist in our community. We know that that alone put us at a level of risk that you might not see elsewhere, because we knew, it was suspected and confirmed pretty quickly that a number of these conditions do put you at higher risk for severe illness and death due to COVID-19.
Although the people we've lost is a small group, their lives lost. And the models show it's only going to get worse as we get closer to the holidays. But health officials say it is possible to slow the spread and save lives.
We've lost a lot of people, and we have the opportunity now to keep that from happening or to minimize that as much as possible.
So far, our deadliest month is July. However, August is our deadliest month for coronavirus. We lost 147 lives that month alone. However, late July into early August was our deadliest week. By our count, we lost 53 people in those 7 days to coronavirus.
And now, Alex, we've learned of 9 more lives lost to the disease. And when did those people die?
I think there's an assumption that those people died within the last 24 hours. That is not the case. What I have found as I, track these numbers every day is it does sometimes take a little bit longer to confirm a coronavirus death. They want to make sure, our health officials want to make sure that it is a contributing factor before they make it official. And so sometimes it does take healthcare professionals a little bit longer to confirm that and then put that on the death certificate. So sometimes we see a lot of deaths go back months. For example, some of the deaths that we saw announced today were lives that were lost in July.
And 455 unexplained deaths. Do you think that there's an underlying cause that might be associated with the stress and the strain of just living in this pandemic? People canceling or being reticent to go to the doctor for regular checkups and their appointments and putting those things off. Could that be a causal factor?
Whether or not you've tested positive for coronavirus, you have been impacted by this virus in some way, shape, or form. Doctors have had to close at some point, just your normal practitioners. So it's still too early to understand why there's this additional, these excess deaths. The CDC, the state, and our local departments are all trying to figure this out because it is not just an issue here in Kern County. This is an issue that the whole entire world is facing and starting to notice as we look at these excess deaths as these trends continue.
Well, it's a troubling report, but thanks for digging deep on that one. We appreciate it. We need to know what's going on out there.
Yeah, I'll keep track of the numbers for you.
Alex Fisher in studio tonight.